that's like the $1,000,000 question. I mean, that's like basically the question that our whole training is answering, right? Is the art of this practice, like how are you actually doing it in the moment? And I don't know if I can sum that up like verbally necessarily in any kind of brief way. But roughly speaking, you are, I'll say like this is a little bit of a skill, like a talent. Some people are really good at this intuitively. You're taking your toolbox of therapy skills. Like you mentioned Freud, I don't necessarily use that model, but I have a Jungian
or Jungian, sorry, yeah.
Similar enough, right? Or a cognitive behavioral model, which is the other, training background that I have. So you have these tools that you would be using with someone in therapy if they were sober, and you are still using those. But what you're doing is you're taking each one of those tools and you're filtering through the understanding of how they're going to be able to receive it and process it, right? So this conversation is a little tricky to have, and I know you're not a therapist and you don't necessarily have that background. So but when you're in a session with someone and you have what's called a case conceptualization, which is your sort of diagnostic and a whole person understanding of what's going on with this person psychologically and what what the needs are, where the healing needs to happen and so on. And you would normally say, I will approach this piece here. I'll use this tool here to approach this particular psychological pattern that this person's having. You would do that. You would also do that, but you understand that you're going to be languaging everything differently because the person is tripping, right? They're not going to cognitively, rationally process information the same way they do when they're sober. They're not going to actually see things. They're seeing reality differently, and they're experiencing themselves, the nature of who they are, differently. Like they're not identified with themselves like they are when they're sober. They may not be identified with their ego or their everyday self. Like you are your everyday self all the time. You're you, right? You know who you are. On a psychedelic, that may not be the case at all. You may not know who you are or feel that you're the same you that you normally are. And the person experiencing the insight or the understanding may not feel like it's even you. So you take your tools, but you modify your tools for the fact that this person is not in the same reality that you're in, but you understand the reality enough to translate. And on a practical level, it's a lot easier to understand it when you see it done, right? And there's also a lot more silence and slowness because there's a lot of waiting for the content to come up for the person, and then you're reflecting it back, or you're helping them reflect on it, and then you're seeing what comes up, right? So on a if I had to describe it on a kind of logistic way, I think it's often on the outside looks like you're moving more slowly and prompting, using and clarifying, but very slowly. It would probably look like that from the outside, but that's a hard one to answer. It really is one of those things where you have to experience it and be doing it to kind of get what I'm talking about.